I think what we need to do with regard FAPMA and SAGMA is basically to activate our websites, have them active on the web, and also upload the various activities that we're doing, including the PAVMA report that Nazim was talking about, the PAVMA report, and also any other engagements that we're doing, Global Fund, Roadmap, and so forth, and outline our agenda in any calendar year, and have an interactive open platform on the website where members can log in and raise the issues, and then the board and the secretariat can respond to that. It's a starting point, really. Okay, thank you.
Because the manufacturers have pain points. So I think that in addition to what the colleague, my namesake, has said, we need also to understand what are the pain points. So the pain points could be a good starting point when we know this is the pain point for this manufacturer, and then going for that pain point, we popularize the importance of the association. Thank
you. Just in terms of UPMA, so already our drive is to build our constituency. So we've extended our membership to veterinary medicine as well as devices, so that we have a better, to the points made earlier around how we are able to, back ourselves and lend our voice to change, to make the change. So that's one of the things that we'll be doing. And I think also, and because of this, we are out on a recruitment drive, to get more members. We've identified a universe of over some 36 potential companies, where our membership stands at less than 20 today. We can double that, so that will help. And then also, we can't ask for a seat, at a government table if you don't create a seat at our table. So this is something that we're also going to do.
Which was is similar to 3, the engagement with government, so we'll skip that. I think we have mentioned about meetings, maybe just scheduling those meetings and putting the person who's responsible. And then 6 was input into plans and policies in collaboration with civil society organizations. So that means reviewing the policies that are existing, looking at the gaps, maybe also thinking about how to take forward implementation. Yesterday, the person from National Planning Authority was talking about how some of the policies are generic. They don't have specificity enough for implementation. So maybe looking at those and identifying the gaps, and to have conversation with the implementers of these policies. So that's, yes. Timeline. Is it difficult to media? Yes, Maria. So,
I would just like to highlight that at Afia-Maliki we have mapped the relevant policies and laws that we think are pertinent to pharmaceutical manufacturing, and we can share. We have both mapped and come up with an analysis, and we are committed to sharing these.
okay. Thank you. I think, did you also, also doing the analysis, sharing the analysis? Is there an analysis?
I think what she was trying to communicate is that we do
The mapped
mapping
one, yes.
and then an analysis, and I think we can have a conversation with associations on how then we can take this forward in terms of engaging the relevant government institutions.
Okay. And I'm guessing you can share those immediately? Maybe in a week or 1 week or so? Okay, I think we'll go to the next one, which is, don't know how actionable this is, but growing the African market. Do we need to reduce it into an actionable thing? Growing. Yes, Doctor.
When we talk about the African market, we are saying, okay, what are the clinicians saying? What are the local policies saying? And therefore, how is the demand being raised? Because that's how we grow it. So it's policy, then training. This is very important in policy and training. That's how we can, so as we think about the production, we should not forget the downstream about the policies. Once you have the policy right, the training right, the market. Oh, yes. This is my name.
Thank you, my namesake. I appreciate that. Okay, I think you don't say growing the African market. It's more of accessing the because the market is already there, so you can't grow it. So it's accessing the market by local players or regional players and so forth. So I think we then need to engage on market shaping policies or engagements so that we then advocate for policies that basically create necessary access to local players and regional players and so forth. So it's more to engagement with market shaping policies at national, regional, and continental level. So I think the responsibility will then fall with national associations, regional associations, and obviously continental association. So it's something that needs to be done. For example, FAPMA can engage Global Fund, PFA, UNICEF, and so forth, and the various associations at their respective levels can then engage the various players. Thank you.
I think just to add, I think there's one very fundamental topic that we haven't touched on, and that is the lack of data. Okay? Now, all of us who are on the business side, running a company, trying to attract investors, the second question, the first question is, where are you based, right? The second question is, what is the size of your market? We really don't know. I mean, we can all take intelligent guesses, right? But there is no audited data that exists. In fact, in sub-Saharan Africa, even in South Africa, they don't have it. So to me, I don't have an answer, but there must be a way of working with lots of other multi-stakeholders to figure out how do we collect real data. How do we collect real data? Now I know, at least when I used to go to the Ministry of Health in Uganda regularly, there's some beautiful charts on malaria and stuff like that. But you go beyond malaria, nobody knows, right? So how are we going to launch products if we don't know what the size of the market is, which products are doing better? I remember when I was a product manager at Pfizer 35 years ago, I had data based on, I could tell you what doctors, each individual doctor was prescribing. Can you imagine? Fantastic real data. So you could really then decide, right, is this market worth even going into? How many competitors are there? All that is lacking. It's all left to individual company specialists to figure it out. But I'm sure some of us are quite wrong, right?
All right, thank you. Since the mic is passing through my hands, I might as well take this opportunity. Talking about market data, we underestimate the importance of data. And it's something that we can use to generate revenues for national, regional, and continental associations. The number of times, because the first port of call, if someone wants to know about the Ugandan market, is the National Association. And in most cases, more often than not, they don't have the information. So I think as members, as associations, we should put in place framework and structures that facilitate the gathering of the necessary data that are relevant to our members and also that are relevant to various stakeholders. That's very important. It's information that you can sell, and some of it you can derive from your companies to say how much are you producing, how much each one of them, what are the volumes, what is the capacity utilization, and what sort of medicines are we producing and so forth. And some of it we can get it by putting in place, I mean, with the current digital age that we are in, there are various platforms one can use to generate that information. Thank you.
Sorry, please forgive me. Just one, just to go on more about this, there was a UNIDO project, Uganda was part of it, where they were basically trying to figure out how do we collect market data in countries like Uganda, Kenya. So I was quite involved in the Ugandan one. So if you look at the Ugandan market, and you guys know better than I do now, you know, there are three aspects of the market, right? One is what are local manufacturers producing, okay? Second, what imports are coming in. Third, what are the donors giving us? So there are three major arms which create the total market, okay? And of course, demand is much higher because we never satisfy the demand, we know that. So we started collecting the data. Anybody from India here? India's data was all over the place. There was no single place where you could go and say, look, how much paracetamol was used or came into the country last month, right? They couldn't tell you. It was all paper somewhere, you know. Companies have the data. I mean, as KPI, I knew exactly how much I was producing and how much I was selling. But am I willing to give it to the government? No, I did. But there was one company I will mention, one company, it's not, and I won't mention the name, they refused. They eventually gave the volume data, but not the value. I said, come on, we know how much your products are. We can easily multiply and get the value. But anyway, so what I'm trying to say is that, you know, it is such a critical thing, but it involves everybody, because everybody's got a bit of it. Now, who has the data for how much, you know, ACTs are given to Uganda? Ministry of Health somewhere has that data. So, you know, we need that data. Yeah? So, okay. Sorry.
Okay.
I won't say.
Sorry, based on time, I'm going to be brief, okay? But I had a point to capitalize on the issue concerning markets. So when we talk markets, we are mainly targeting what we companies need, but we forget the consumers. There is a problem we are grappling with extensively high as manufacturers, is the ability of the people to purchase products. And when we looked into this, the taxes implicated on the people are way high. Imagine a person earning 10 million, for example, and he has to pay close to 5 million in pay as you earn. So Uganda Investment Authority will request to be involved in the upcoming tax frameworks so that at least we defend the people. Because if they are not able to buy, we won't able to be in a market or produce. So private sector foundation in their review policy, working on the new tax reforms under this category. Then the issue of data, we are already working on it with the Uganda Bureau of Statistics. We want to address that, and I've written an MOU to AHATU because they are researchers. Further on, I want them to assist us in drafting real concrete reports to address that as well.
And we recently submitted the tax proposals to the Ministry of Finance. So I'm suggesting, and the deadline was last month. So I'm suggesting if you can send in your tax proposals as soon as yesterday and send it on email So we find a way of it passing ahead of time. So if you have those tax proposals ready, you can share them, so we send them before the final report comes out. So we are going to share the draft. Please help fill it as fast as you can, share it back. Thank you.
I just want to point out that also in that point of growing the market, there was an issue of the Africa cognitive code area that still is not fully operational, and there are still many barriers to clear. So that there is a cross-border business and trading. And then it was also mentioned that we need the African Medicines Agency to become operational for quality assurance purposes, so that we can be able to continue to engage the Global Fund, Gavi, and UNICEF for purchasing and procurement from local manufacturers. So I just wanted to put that across.
Thank you, Hasu. I think from the conversation, yes? Okay.
Thank you. Just a quick one. Talking about taxes is good. But I think just advice also, especially on the Ugandan context and maybe others also. The taxes alone and discussing taxes is not going to reduce the cost on the consumer of our medicines. It's not wholly going to improve or rather create us better access to the markets. Because ultimately, if people are always paying out of our pockets, I think that it becomes a huge constraint. And this is why we're talking about health insurance. This discussion ought to begin, brothers and sisters, in our context. Because if we look at it, can we evaluate how much volumes in terms of business that can create for the private industry? Because the earnings there, if the Zambian stage, I think the scenario is changing. By one big factor, the introduction of health insurance is a game changer. And I think we need to speak to this factor also. Thank you.
Thank you. I think the conversation is just helping us to redefine the actions. We may not be able to get into the timeline bits and assigning responsibility, but I hope, Hasu, that you're refining because all these policy engagement training and have come under the market element. So allow me, I think, to move forward to the next action. This strategizing meetings with the association, strategizing meetings, this is with the association, so that means with membership. Maybe timeline, all these are happening regularly. Maybe you have quarterly meetings, you have a strategizing meeting with the association, maybe to discuss the issues that have come out from this engagement, and yes.
What I captured, I requested for a report from Meta, the other draft report. I want to address it to the chair to take some time to read it. And I'm also happy that in this same meeting I've had more of my members in attendance, of which we are going to voice the concern that in the ongoing programs implementation, we shall collaborate more with CROs. So that's we should find ways that are actionable. If it's expositions, if it's meetings, if it is research, we shall tackle each independently as it needs to be done. So I'm happy that they've seen the importance of civil society here with us, and I think we shall address that.
Thank you. So I would say that would be ongoing or recurring, depending on the need. This is something we discussed earlier in terms of value for membership, and I hope that we refined it in the discussions that we had. Review of the utilization, review to utilize the TRIPS flexibility. I think this came from HIPS. who are already doing a report. Joan has moved out, but maybe she would commit, the HEPS would commit to take responsibility of this. Maybe we convene members to take them through this or engage with the association and the stakeholders. Yes.
I want us to expand the stakeholders involved in the review of trips. As an association, we may not handle that docket alone because it's a docket which needs also experts in laws and patents, which is a legal aspect. So we may need people from legal to assist in that. Then as manufacturers can as well enter as players in it. So that's how we can execute it effectively.
Right, maybe has to follow up with Joan in terms of timeline and the actual engagement for that. So we are assigning them to that. Building negotiation capacity, trade negotiation capacity, I think. Yes.
Sorry, at AFIA, we also done an analysis on how we can take advantage of the TRIPS flexibilities, and we commit to share by the end of this month.
Okay. I think there's Siatini is the one who spoke towards this in terms of building capacity for needs as one of the commitments you made during the panel negotiation, building negotiation capacity, trade negotiation capacity. How do they engage? How do people engage? Do they reach out to you? Do you reach out to them? Okay, thank you. Yes, more specific.
Is explaining the general bit.
Yes.
Could we tailor it to maybe, because I think it's, as part of this project, Siatini is in some countries, but so you could promise maybe to do it for Uganda Pharmaceutical Association at a particular date or something like that.
We are still conducting campaigns.
They are part of the capacity building engagements, and ideally we are engaging on a regional level, but the commitment, as earlier alluded, I think it will be more specific. I don't think we can be more specific because it's advancing regional vaccine manufacturing. So it will entail Uganda, East African level, and also Southern Africa. That's at all those levels. Yeah.
I don't know if that's specific enough.
Is this specific? It's not. Yes.
Okay. I think we'll sort that out. Strengthen the advisory role of the association. This is what exactly are we going to do in terms of this? Maybe how are we strengthening the advisory role? Maybe that would help us to think more specific. Are we building their capacity or whatever? And I guess the association, I don't know who's responsible. The association probably.
I wanted to address something first. The way you wrote ongoing meeting, could you change it to by 31st October? By 30th October. So we shall have implemented that meeting. Then the issue of strategizing the advisory role of the association, to be honest, as members of the association, we already know, but I think we need to put other players, that is civil society. We need to put government. Here we are going to have more input by Uganda Investment Authority, because with them that's when our voice can be stronger, I would say. But regarding the timeline, Uganda Investment Authority will suggest us a timeline to meet to embark on the implementation. But with the National Planning Authority, we've already arranged a meeting for next week.
Just on the strengthening of the advisory role, this talks to, Robina. We have to have a discussion with Moses on how we can, get that seat at the table. So we're talking about NDA board. How does that develop? From our perspective, we need to, nominate somebody from UPMA. We have some ideas, and then, using civil society to, to push that agenda. So, there's a conversation that must be had, but yeah, I don't know the timeline. Maybe we need to come back to you with the timeline.
So, allow me just to recognize Dr. Helen Daji. She's the Director of Product Safety at National Drug Authority. You can just say hello to the people in just a small word. You found us in the way forward of the meeting.
Thank you. I'm sorry that I'm late. I was in another meeting around Entebbe. But I wanted to contribute to, I heard the previous speaker say that there is Uganda, there is maybe negotiation on for a position on the NDA board. Well, that has, I don't know when, we are not very sure about when that will happen, because at the moment we are reviewing the act, and it's with the drafters with Ministry of Justice. They are handling the first draft of the I don't know what the name of the agency yet, because it's not yet approved. But that negotiation, in fact, they have, in the new act, they have cut down on the number of representation. It's no longer constituency based like the previous act. So I don't know whether that is a feasible thing that we want to measure ourselves to.
So the question, I guess, is, does NDA see value in having manufacturers through the Uganda Pharmaceutical Manufacturers Association on the NDA board? Do you see value in that or not? I guess is the question.
I don't think that would be, well, maybe there would be value engaging with the manufacturers. So maybe in a separate forum, but not by representation on the board.
May I add on, there's a time I was having a training with my colleague who was here by an FDA former consultant who works in FDA. And to them, it looked like their framework of work, even in the top management of the FDA, they have somebody who represents interests of manufacturers. So when the strategic plans of the FDA are being developed, all the input of the industry is underway. It eases access of medicines to come first on the market. It strengthens the policies suggested to be implemented faster. So what we have been having as NDA was a committee which is too large, with a board which is too large, but most of the people on it maybe have not contributed to the objectives of your board, that you have not yet begun to see value. So that for us as manufacturers, we saw a gap of our inefficiency of activity because we were never in a long-term planning as NDA. So that is why we requested from mandate that if other players were on the board, why don't we have a voice since we are the most impacted sector than other players?
Of course, it is the issue of conflict of interest, but I think that well, as NDA we shall be open, because now the board will be down to either 7 or 9 members, which honestly I don't think it will be possible to say that there is a particular representation from a particular constituency.
But I think yesterday we were discussing opportunities and possibilities. And I think that's a conversation we can explore on opportunities on how that can be further explored beyond this meeting. And I think we will have to continue the conversations beyond this, because we agree that we have more opportunities for engagement, and it's important to continue those conversations even beyond here. The beauty is that we've had conversations with various institutions, and now we know who to approach in terms of engaging moving forward. Unfortunately, we want to get into close in this meeting. We are very respectful that we have regional people in this room, and they'll be preparing to travel back this evening. So you will bear with us that we cannot proceed any further, but we want to appreciate you. The way Dr. Gertrude is looking at me, and she's the one traveling tonight. Let me just give her just 1 minute. But I want to thank Anne. We are going to ensure that whatever has been mentioned here, we are going to track. And after this meeting, we'll be giving the proceedings and perhaps give further input into what has been shared. So Anne, let's give her a round of applause for leading us in that session. Dr. Gertrude, just 1 minute, because you are around traveling later. So that's why I'm giving you that 1 minute.
Thank you very much. Now, I wanted to follow up on the conversation about the seat and the NDA, that they could consider a possibility of observer status. In Southern Africa, there is a collaboration of regulators as a bona, and the associations, SACMA, FAPMA, have got an observer status there. So they don't influence what happens there, but they are there to do the debate. Thank you very much.
Okay, thank you very much. That was important not to be missed. So, I don't want to add anything more, just to thank everyone as we conclude this meeting in terms of logistics, because the person who is going to close once the big people close, you don't say any much more, you just march out and leave, or say hi, rub shoulders and leave the meeting. So, in terms of logistics, we thank you very much. If you had any issues, please, you can reach out to Haki and also Dumiak Meta team. Joan is around. And in terms of any modest facilitations, the team from here, Uganda and the neighboring places, internally here, you will be seeing the team from Dumiak, led by Joan. They're outside there. And then the team that travel within, you'll be seeing Maria. Maria was one of our moderators. She will be kind of sorting you after this meeting. And then once the closing remarks are met, we want to invite you to our lunch. There will be lunch, of course. Don't travel back when you're hungry. I know when the meeting is ending, people are thinking of the next destination, but don't leave the lunch, please. So this juncture, allow me to thank everyone, and allow me invite Dr. Munda Moses, the Director General of Haki, to officially close this meeting for us. You're welcome, Doctor.
I fear that Karun is going to stand as a politician very soon. He's creating a lot of pomp out of my small assignment that I've been given to close. So I am not in any way representing Dr. Diana, who was supposed to be here closing. And I understood she was on the way, but I think time has run out. That said, it gives me such pleasure to make the closing remarks for this very important convening. I am not just making the remarks as a participant, but I am an interested person, very, very interested professionally in the subjects that the teams have been discussing over the last 2 days. I thank Meta. Meta, I have a long story. I think it was not this hotel. It was this hotel where Meta was started in Uganda. I was a very young man, and I was invited to facilitate with Jackie Asimwe, with Wilbert many years ago when Meta was starting. So really collaborating with Meta after close, coming to 15 years since its inception gives me such pleasure. Meta, Dumeik, Ahaki, where I work, and the AMA partners, thanks for convening this. I think the conversations that have been happening have been part of my professional life for 20 years now, when I was introduced to the subject of access to medicines. My entry point was intellectual property and access to medicines, where we spent very many years, and as a young lawyer, medicine is solved. I remember going to Nazim then and convincing him that once the law is passed, we are good to go. So Uganda had a patent legislation that had been passed in 1996, and we are trying to comply with the WTO requirements. So we had not integrated the TRIPS flexibilities in the Patent Act. And along the way, we had the anti-counterfeit legislation introduced, and it became a huge threat for access to medicines, especially generics. At the time, they introduced a law that was defining anything made that was substantially similar to what was existing as a counterfeit. In business sense, if you've made Adidas similar and say Adidas, then actually it's known. It makes sense. But for medicines, unfortunately, it didn't make sense. I'll come back to why that's very important later on for the pharmaceutical manufacturing associations. And before we knew it, anti-competition legislation was becoming very important at the national level. And then the East African community picked up conversations to guide East African countries on how to integrate TRIPS flexibilities in the national legislation. And the ESC then struggled a lot to make sure that countries were actually integrating the policy space, because under the TRIPS agreement, least developed countries were not required to comply with intellectual property legal regimes. And yet, countries were already voluntarily entering into these obligations. Now, it became a huge threat for manufacturers, including quality chemicals, which at the time was on the block and everyone's focus on producing generics. Before we knew it, the ESC was also suffering with an anti-counterfeit legislation, which we pushed back. And then we saw that flexibilities were actually integrated in national legislation, but this was still not resulting into what was expected of pharmaceutical manufacturing. So we ventured into picking interest in what was the problem with local pharmaceutical manufacturing at the time. And together with Dennis and a few colleagues who have since moved into other areas of practice, we did interviews of pharmaceutical manufacturers. One thing I'll never forget in an interview with Nazim, he said, I'll give you an example. A pharmaceutical industry was closed, and the owners of that industry decided to manufacture quencher and biscuits. Don't know if you remember it. And I have never forgotten it to date. What motivates someone to leave pharmaceutical manufacturing to go and manufacture biscuits? I don't think I've ever got the answer. The same challenges we've been discussing today have been the same challenges that have been on and on and on and on. So this time around, as we were thinking about this meeting, I had the privilege to have a conversation with Dr. Chivira, and I told him one of the findings in 2007 was that pharmaceutical manufacturing and associations were important. But they don't seem to be coming in the picture all the time. And yet they are making efforts to actually exist. What's the problem? Can we document and find out what the role of pharmaceutical associations would look like? And over the last month, he has been doing that with colleagues. And the findings are actually pointing to the fact that there is opportunity for these associations to actually function better and be facilitated better. I've been telling colleagues outside, people think level and regional level are a result of thinking. But as a person that has been part of institutional development, I've realized that if you only have thinkers as part of your team, then there's no implementation. I don't want to say this, but very good implementers don't think a lot. They are extremely good at implementation. So I want you to think about this scenario and how it applies to the case study of Bangladesh. Have they been more thinkers and spending a lot of time thinking, or have they borrowed what other people have thought of mentors? And sometimes striking a balance between those two areas is very difficult. And it's something that we need to think about. I missed yesterday, but today I've been struck by things that have been discussed. The trust issue is what I pack in my bag as I go back. Trust issues have been disturbing me, and I've never found the right framing for it. And as I said before, thinking about civil society coming together with the associations of pharmaceutical manufacturers is a historical scene, and that I can repeat, because civil society traditionally has looked at pharmaceutical manufacturers as people who make profit and don't care about patients and lives. But that's not the problem with pharmaceutical manufacturers. In my African thinking lately, we need to draw a distinction between the big pharma problems and our problems as African pharmaceutical manufacturers. The problems the other side continue to impact us. But how have you used the opportunities that we have in the spaces to actually say the challenges of big pharma, the other side, are not necessarily our challenges? I always like to remind people that neo-colonial tendencies are continuing to be big. And if you've not thought about how neo-colonial tendencies are impacting on pharmaceutical manufacturing and the work of the associations, read more. The problems the other side are inevitably impacting on us. The colonial legacy needs to be relooked at. What happened to the African thinking of pharmaceutical manufacturing? Who sets the standard? If NDA is implementing, and good to see you, Dr. Ndagije, again, if NDA is implementing what it is implementing, who set the standard that NDA is following? These days, as a critical thinker, I have challenged our own institutions, like the National Drug Authority, to move outside the traditionally set standards. You know that on the African continent, we are not asking for less standards, but we are asking for contextual standards. But who makes the case for contextual standards? Everyone that comes and talks about standards reminds us about the international standards. And someone has said WHO, and I agree, it's the big brother. Who controls the WHO? Solomon, I don't know where you are, but you asked this question. Who funds it? And he was wondering that pharmaceutical industry funds it. Did you know that the bill and Melinda Gates, the budget they give WHO, is twice as much as Germany and Japan combined? Twice. Now, don't be surprised that WHO makes some decisions, produces some standards, and I don't want to challenge those standards, but on the African continent, we need to move beyond the standards that have been set as international and this and that. And sometimes maybe it's the role of civil society But I also look at the local pharmaceutical associations as part of civil society, who should be challenging this paradigm much more than what is happening. We should be guiding government. We should be guiding entities like the National Drug Authority and challenge them. Dr. Ndagije is right. She can't see the pharmaceutical industry represented on the board. It's about the association to challenge the status quo. When this law, I was part of the board many years ago. I don't know, it's coming to 6, 7 years ago. We were discussing the same things. The law amendment was happening. But how many times have the associations actually gone to the legal